This calls himself a medical doctor. He's here with us to talk about diabetes. And I've got a problem with this simply because it says he can reverse diabetes. Now, there's a lot of people out there with a lot of claims. We'll find out why he's saying what he's saying. Doc, welcome to the show. It's a pleasure and an honor to have you here. You've taken time off to join us for 10 minutes to talk about diabetes on World Diabetes Day. Where do we start?
All right. We talk about World Diabetes Day. In Malaysia, how's the situation now? As of now, 1 in 11% in the world is a diabetic. But however, in Malaysia, we're talking about 1 in 5. That's like horrible. But what is so scary about this diabetes? So we do know that in diabetes is the blood sugar that is very high. And when the blood sugar is high, it causes inflammation of our blood vessels.
Right.
And this causes narrowing of the blood vessels.
Right.
So you can imagine that if the narrowing happens in the brain, it causes stroke. It happens in the heart, it causes heart attack. And then it destroys the kidney, the eye, and it causes amputation. All these risks goes up by at least twice in any of the patients who suffer from diabetes.
Now, just to get things clear,
Yes.
Because we don't want MOH calling us and saying, is this a legit doctor? This fellow is an alternative guy. We don't want all that to be happening.
Yes,
So,
yes.
so your qualifications is as a medical doctor.
Yes, yeah. I received my MBBS from Melaka Manipal Medical College back in 2009. So I started practicing as a medical doctor. However, something happened during my practice.
Right.
That was back in 2013 when I was misdiagnosed with pancreatic cancer. They found a growth as big as a ping pong ball seated at the head of my pancreas.
Right.
And I suspected it was a cancer and they wanted to operate on me. That was when I told the doctor attending to me, I said, no, we have to find out what exactly it is. Let's find out the root cause.
I mean, being a doctor, naturally you'll be curious and you'll want to know, investigate more. Yeah.
Obviously. And then finally they found that it was actually a TB infection, tuberculosis. Right. So I escaped from the operation, and that was when I told myself, every time I see a patient, I must always look for the root cause.
No, but seriously, what's it with doctors? I remember I had a heart attack. And the first thing the doctor told me is, your life is never going to be the same again. Why do you guys even do that? I really don't understand. But you're talking about reversing diabetes. Now, that's quite a strong statement. And in Malaysia, you put a statement out, people can, we can turn it into a mound, into Mount Everest, So
I understand.
So
why do I say that? As I mentioned, we are very into root cause now. So what is the root cause of diabetes? And if we sum it up in 2 words: insulin resistance. So what do we do with insulin resistance is...
So you're talking about type 2 diabetes?
Type 2, yes. Just to clarify, we're only talking about type 2 now for today. So for type 2 diabetes is insulin resistance. Therefore, what we do is, in reversing diabetes, we try to improve the insulin resistance by bringing down the insulin level. How? So we know what triggers the insulin to be released is sugar. We're talking about carbohydrates here. So I have a couple of patients with me, about 20 to 30 of them, where I help them to reverse their diabetes over a period of time. It take about 6 to 9 months, not something that is immediate, and where we advise them on proper diet plans.
But that's the thing with us Malaysians.
Yes.
We want things yesterday, I mean, but okay. So working with 20 to 30 people, and you're helping them reverse diabetes. Now let's just clarify here that in saying that you're wanting to help someone reverse diabetes, you're not curing it.
No. There is no cure, because the diet plan that we offer,
maybe there is, but Big Pharma doesn't want to tell us, a lot of money to be made from pharmaceuticals.
I wouldn't comment on that. Anyway, yes. So we offer them diet plans to reverse the condition. So what we do is, initially they come in with their drugs here, their medications, and the diet plan here. So we slowly bring it up this way. So finally we just drop off the medications, and then they are on this diet plan basically for the rest of their life.
So here's the thing, when you drop them off medications, and when they meet other doctors, saying now if they're coming to you for treatment, and then they go to another town, they're going for a visit, something happens, they're taken into a clinic or a hospital, and the doctor will, of course, investigate and find out what medications they are on, or what they're doing to keep their diabetes in check. Now they say, oh, my doctor told me to stop my medications and do this. How would they answer this question, and how would you help them give enough evidence to the people who are treating them at that point?
So for us, we make it very clear when
Sorry for the long question.
When a patient actually engage our services, we make it very clear to them that now we are doing it using the alternative way and not the conventional way, which means it's going to be very different from what their doctors would have explained to them. And to be fair to them, to the doctors, it's not really their fault because that's how we are being trained in medical schools and things like that. I was inspired by this doctor from US, Dr. Sarah Hobart, where she actually shared in TED Talk how she managed to reverse diabetes, and that's when I wanted to find out is that what is the root cause of diabetes, and from there I started having patients, and we are seeing results where we normalize their blood sugar and things like that. Yeah, so we told them that this is how it is. Yes.
What is your method? What's the methodology that you use?
Okay, so I believe many people would have heard of it. It's actually the ketogenic diet, or what we call the low carb, high fat diet. But to make things very clear,
but keto diets also, we've got a problem with that. People are talking about keto diets.
Right.
Your kidneys may be affected, so you take high fat, high protein. Isn't it?
Okay. One of the major misconceptions about keto diet is they are saying that it is high protein. In fact, it is not high protein, but it's more of high fat. So we're talking about good fats here, where we are able to help patients. Because when we bring down the amount of carbohydrates, we need to bring up the fats because that's the one giving them the energy source.
Right. So you're using a ketogenic diet.
Yes.
That's your modus operandi in order to help people reverse diabetes mellitus. The other thing you were talking about, or off the air, we talked about a little bit about intermittent fasting. There's if buts, maybes now about intermittent fasting. What's your take on this?
For my patients, after they are stabilized on the keto diet, what I do is I'll put them on intermittent fasting. Because if I put them immediately on intermittent fasting, it may not last for them because it makes them feel hungry. So with enough fats from keto, basically they feel fuller and they won't feel hungry so easily. And in Malaysia, it's difficult for us to feel hungry. Why? The reason is because we are living in food paradise. We have food 24 hours a day, anytime, anywhere. So make sure that they are always satiated, they are not hungry before they move on to intermittent fasting.
I think my producer's got some questions for me. You can speak a little louder. Anyway, coming back to World Diabetes Day, there's a lot of news out there. A lot of people trying to create awareness. What are some of the things we know now that we didn't know, say, 1 year ago or 2 years ago about diabetes?
I would say diabetes is reversible, not curable. In a way, you can really control your blood sugar well without using any drugs or medications for that matter. Diet is the key to go, of course, and with the right amount of exercise and with the right amount of sleep, and of course manage your stress better, and all this can actually help in terms of diabetes.
Right, so people are now talking, even on Netflix, if you watch Netflix, there was a documentary about plant-based diets for reversing, say, cardiovascular problems for diabetes or non-communicable diseases. But are doctors in Malaysia warming up to it? Now, if you go across the road to one of the private hospitals here, would they say that what you're doing is not the right way of going about it?
I think there are many school of thoughts in terms of diet plans. We sometimes really don't know who is right, who is wrong. But we look at the current result. I mean, you look at diabetes, it's an epidemic in Malaysia. And it's not just diabetes, but it's also obesity. We are like the fattest country in the whole of Asia. And this all leads to
Malaysia
right. All this leads to other diseases like hypertension, stroke, and heart attack. And this is very saddening.
But we also are forgetting now the Ministry of Health is pushing a lot on mental health. Okay?
Yes, mental health.
I mean, it's your physiologically, it's important to know what's happening with you. But mentally, things start going wrong upstairs, it starts to affect the rest of the body. Hypertension sets in, you start getting borderline hypertensive, and then you start eating, because you're probably depressed or borderline depressed, and then all these problems come about. Now with our diet too, Malaysians, we live to eat. So that's another one of our problems. Great Chinese food in Ipoh, superb nasi kandar in Penang, go to Johor, got Pasumbo, how lah.
That's why you see, I've been doing this reversing diabetes program with my patients for the past 1.5, 2 years. I started off being very rigid, and I told them, no, you look at this you cannot eat, that you cannot eat. But slowly I learned to be more flexible with them, and I tell them, look, you just have to be very careful with those the food where it's really a major portion of carbs. For example, like one bowl of rice, that is really a complete no-no. But let's say if they want to go into a fast food restaurant like KFC, I do allow my patients to take a bit of, you know, Kentucky Fried Chicken, you know, but of course not often, but they are able to still, you know, enjoy a little bit.
Because indulge now and again.
Yes, correct. Yes. So we really cannot stop them completely, because when you stop them completely, they stop coming to see us, they end up going back to medications, and we won't be able to help them. Yeah, and that defeats the entire purpose of reversing the diabetes. Yeah.
Right. So there's so many doctors in Malaysia, and on World Diabetes Day, we decided to bring you in. You know, what would be your message to Malaysia?
Be hopeful, because diabetes is reversible. This is the new thing, and you can really reverse the condition. You can actually drop off your pills, but do be very careful when you start applying this ketogenic and low carb high fat.
Okay, you said pills. What if you're on insulin?
The same goes to insulin, but of course
that's another bold statement here. You know, we're talking on national TV.
Yes, we are, because I have patients where because for patients when they come in, the first thing that I drop off is insulin first. Of course, gradually, not suddenly. And we are very careful when we bring down the medications, because it may cause hypo in them, hypoglycemia, which is low blood sugar, which is in fact more dangerous than hyper to a certain extent.
So hypoglycemia is the low blood sugar when you don't have enough sugar in your system. Hyperglycemia is when you have too much sugar in your system. So
either way is not
a
good
disclaimer for us. Here, these opinions are the opinions of Dr. Andrew. And I mean, simple advice for those of us still on medication, and saying we don't want to give up our medication, but we want to try a little bit of a plant-based diet or ketogenic diet. What would you advise? Or what's your tip?
It is better that you still get a medical doctor to monitor your blood sugar for you while you are applying this diet plan, so that your sugar is stable and not not go too low or too high in the process, because it might be dangerous as well.
Right. So thank you very much. It was a pleasure having you in the studios.
Thank you so much.
It was a pleasure and honor. World Diabetes Day. I can't wish you happy World Diabetes Day. We're hoping for the world to be eradicated of this dreaded non-communicable disease. We'd like to thank Dr. Andrew Chew for coming in. So to wrap this segment up, what he's saying is that you can reverse diabetes. You can't cure it. You can bring yourself to a normal state if you eat healthily. And a couple of diets you need to look into is a ketogenic diet and a plant-based diet, but you need to be advised by a medical doctor. Am I right?
Exactly.
Did I get it right? Stay with us. We're going to take a short break and come back with more for you right here on Bernama today.